RSV can be serious for kids, and as News Center Maine's David Guilford reports, doctors from Maine's two largest healthcare providers joined forces today to answer questions about its impact and how they are responding.
This is Ozzy. He's 16 months old, and he's not the boy his father Zach and mother Cassidy recognized.
If you knew Ozzy, this is not Ozzy.
He would be bouncing off the furniture, she said, but for now he's confined to a bed at Maine Medical Center's Barbara Bush Children's Hospital, fighting respiratory syncytial virus, or RSV.
When we got here, they were like, he's okay, this is what we're seeing. He started getting better, and then he started getting worse, and that went right back to, is my baby gonna die?
RSV is a common respiratory virus that usually causes mild cold-like symptoms, but in children, it can be serious. And what's not common is how hard it's hitting Maine right now.
We have admitted a record number of RSV patients. Half of our patients admitted right now have respiratory virus, and the majority of those are RSV.
The state's largest hospital groups, Northern Light and Maine Health, hosted a joint press conference Friday to talk about how Maine saw typical peak season patient loads in October when they'd expect them in January.
I don't know whether that's just simply shifted and come January we're not going to have much, or whether it's the beginning of something bigger.
On Friday, all 87 staffed pediatric beds at Barbara Bush in Portland were occupied, and nearly all 37 pediatric beds at Eastern Maine Med in Bangor were full as well.
Unfortunately, there is no treatment to keep the child from getting the virus, or from the virus getting worse, or to cure the virus once the child has gotten it. It's just a matter of supportive care, which we have the capacity, thankfully.
The good news is hospitals have been fighting RSV for decades, and the doctor said we can limit its spread with the same measures we've gotten used to in the past 3 years. Keep sick children out of school, wash your hands, and get your child a flu shot, as doctors worry about a serious RSV season running into flu season.
Sweet boy.
Back at Maine Med, Ozzy's family hopes to free up this bed soon and head home with their son.
Hopefully we'll start playing and be our bouncy boy that he is.
In Portland, David Guilford, News Center, Maine.
And Dr. Dora Mills with Maine Health says while RSV has been around for decades, it likely has not caused widespread trouble in the past few years because typically only one respiratory virus at a time is able to achieve widespread infection, and COVID cornered the market, so to speak, since 2020.